Hi, I'm Bob Asher, Executive Director of Prime Plus Senior Centers, and this is Prime Time with Bob, a new edition called Doc Talks. And I'm on with two very special people from JenCare, who are great partners with Prime Plus. They've been very supportive of us. We have T-shirts, in fact, with their name on them. So if you haven't seen the T-shirt, come on in and check it out. So our Waddler, and I butchered your name, of course, you were the one that called and said, we want to do this.
Yes, I am.
How did you hear about us?
Okay, so I heard about y'all because, of course, last year I was working with y'all and doing a lot of tabletop events. Of course, the T-shirts, but going and doing coffee and tea with JenCare. So that was very instrumental. I got to meet a lot of your patients, a lot of your members, and they are awesome. When I say that your people have a lot of energy, they have a lot of energy. And I love the classes, especially Zumba, because I am a Zumba fanatic myself. So
Well, you know what? We're doing in person. Of course, they're smaller classes, and you can do them online now. So if you're watching this,
wonderful.
yeah. So you can do it on Facebook Live, or you can do it on Zoom.
Okay, that is wonderful because our patients have been asking. So it's good to know that y'all are doing it online. So definitely after this video, I want to get the information so I can send it out to all my patients.
Yeah, because we're on YouTube. We had to, what they call it, pivot, which sounds like a medical term to me. I don't know. I guess I'll check with the doctor. Is it a medical term? Dr. Keys Frizzell, is it a medical term to pivot?
That's a good question. I'm actually thinking about a ballerina, but maybe it is medical. I don't know.
This conversation is going all the wrong directions. But tell me about JenCare. It's a very special place. But for those that haven't been there, what is JenCare?
Well, JenCare is a senior medical center. We are designed for the ages of only 55 and up. Right now we are in the hearts of the neediest population. So that's where you'll find all of our centers, because seniors are near and dear to our heart. And those are the ones that people forget about. They forget to call and check on your seniors, your grandparents, your granduncles and aunts. And during these times, especially during COVID, we find that they are the people that definitely you need to reach out to and you need to call very often, because at times, if they don't get visitors and they don't get phone calls, they forget that, or they may want to give up. And that's not what we want. Each one of our patients, they're not just patients. These are our family members. We see them sometimes more than we see our own family. And in the community, there's never a time when I can go into Walmart or Food Lion and they'll say, hey, that's the JenCare lady. And, normally everybody knows I'm such a smiley person, and Dr. Keys Frizzell is the same way as well. But JenCare is very near and dear to my heart. And the reason why I'm here is because 4.5 years ago, I inherited my grandmother, who, when I got her, she was in a wheelchair. She couldn't feed herself. She couldn't do anything for herself, and she definitely wasn't able to live alone. Well, after me bringing her down here from New York, she was with me for about 2 months, and I was like, oh no, what do I do? She needs a doctor. And I just happened to be sitting at the light behind a van, and it says, we'll pick you up. I said, hey, call this number. Let me see what they do. Well, upon investigating, I found out that not only, will we come and pick you up, but also we do our own lab work in-house. We do our own x-rays in-house. Plus we have a pharmacy. So you don't find like normal medications such as like prenatal vitamins in our pharmacy, because of course we're 55 and up, only for our seniors. So when you come into our building, it doesn't feel like a regular doctor's office, and it shouldn't, because it's not. We do that and then more. So in addition to our PCPs in our office, we also have a cardiologist, we have a podiatrist, we even do acupuncture. So we do a lot. And of course, just like yourselves, we do exercise classes such as Tai Chi or Silver Sneakers. But right now, because of COVID, we haven't found a safe way to implement our classes back in. But of course, we do so many events in the community. We have the senior proms, we do speed dating, we do a lot. So right now, I wouldn't say that we're just a doctor's office. We are a community doctor's office, full of family members. We probably have some of your family members here as well.
Mm-hmm.
So I urge to the community, JenCare is more than just your regular doctor. You're going to be seen here more than you've ever been seen with any doctors before, because we are also preventive care. So not only do we want to keep you happy, healthy, safe, at home, out of the hospital, but we also want to get you moving back in the right direction, get your healthcare moving, get your numbers coming back up, get you off of those walkers, off of those canes, off of those 500, medicines that you're on, and get you down to one and get you feeling like yourself again. And that is amazing in the senior community. I think everybody needs that.
Yeah.
So that's
you mentioned something early on that is really a piece that we've plugged into at Prime Plus, that, the safest place to be is at home.
Absolutely.
But there's this silent vulnerability of being at home. And we're seeing this with people now coming out to take our classes and they're a lot smaller. We have to say, we're at capacity at 12 instead of 40 because of the COVID restrictions. But my concern is that in 6 months, we knock on the front door of a senior, what are we going to find? And so if you know a senior, or you've got, like in your case with your grandma, check in with them. Do it the old-fashioned way and call the landline.
Absolutely.
But then once you've done that, if we can get our seniors tied into technology, then there's all kinds of opportunities. Doctor, one of the things is we talked prior to the taping about telehealth, and there's a lot of talk about that. And my view of it is it's a great way, because getting out of the house is so hard sometimes for seniors that it really makes medical care accessible. But you kind of have to learn how to do it, don't you?
Right, exactly. I think that there's a learning curve for patients, and we were talking about that it's hard for some patients who may or may not have the equipment as well as the know-how. And we talked about how sometimes what we have utilized is just to engage their family or friends or neighbors to help us to get them connected to telehealth. So that's been a really important part of how we have delivered care during this pandemic to our patients, is to get them engaged into the telehealth system some way or another.
Now, before I start having my conversation with you, I've got to share that what I know about medicine, I learned on TV, which is probably most of your patients. Let's go back to early March. What was going on at JenCare in early March?
So in early March, we were very concerned. We were very vigilant about what was happening. And in our corporate office, which is in Miami, they mobilized very quickly, very rapidly into action in terms of trying to get as much information as they could about this virus, about how we should best protect ourselves and our patients. And then they got that medication or that information disseminated quickly to the centers throughout the country. And almost immediately, within 1 week's time, we were able to pivot, to use your term, we were able to pivot from providing primarily in-center care and switching it to mostly telehealth, because at that time, we didn't want to bring anybody into the center until we knew what was happening. So that's what was happening in March. We made a quick pivot. 90% of our patients throughout the country were being contacted by phone or by video. And we felt really proud of being able to do that, because it was a very short period of time, but we were able to contact 90% of our patients within a week of this pandemic breaking loose.
So at that time, what were some of the symptoms that you were looking for?
So at that time, what we knew is that people presented with fevers, shortness of breath, and cough. Those were the three big ones, right? We were telling people, look for a fever, look for a cough, look for shortness of breath. So that was pretty much what we were looking at. That's what we were seeing when we saw patients, or when we talked to patients who may have had this. Those were the three presenting things.
Okay, early March, I'd go to Google Med, become a doctor,
Yeah.
and it told me that I might be having bronchitis.
Mm-hmm.
So how did you know it was something different?
Well, that's a really good question because, some of the symptoms can be just like bronchitis. But this virus was a little bit different because it's very aggressive fairly quickly in the people who are going to get very sick from it. So if you were symptomatic, and at that point, it wasn't widespread in the community, we were also asking, had you traveled to an area where we had seen a lot of this virus at that time? It was Washington State. Or had you been out of the country? Were you exposed to someone who you knew was COVID-19 positive? Or had you been undertaking air travel? So those were the kinds of things we were focusing on at that point because there wasn't yet community widespread.
Now we're doing this interview I have a feeling between appointments. So when you start seeing multiple people coming in with the same kind of symptoms, it doesn't really matter if it's COVID or whatever, you recognize that it's being repeated, right?
Right.
So we're heading, okay, now let's fast forward, because now we're hearing it's not just, you can't smell or taste. There might be gut pain, but you're able to breathe. So now it looks like it's kind of morphed. How do you keep up with it?
Yeah, it's observation. One of the best things, I think it was Yogi Berra who said something about you can learn a lot about watching people by observing them or something like that. So observation is the key. And I think that we have just observed over time that some people presented with GI symptoms, gastrointestinal symptoms like, diarrhea or stomach distress, but we didn't recognize that may have been part of this syndrome. So I think as time goes on, then we have noticed that this syndrome may present in a variety of ways. Honestly, a lot of people will have fairly mild illness that can be managed at home, but there is a percentage of patients who will have much more severe illness, and those folks may go on to develop all those other symptoms, the GI symptoms, the other things.
And we've had public display of a variety of responses to the illness. And as a medical professional, can you predict if I present with the two of us come in, and obviously I'm older than the gal who was very light on her feet. Did you notice how she just kind of wheeled in and wheeled out of the picture?
Yes.
So the two of us present with the same, sorry, I couldn't resist. That's what I love about the new world of technology. It's kind of, but the two of us present on the same morning with the same symptom. Are you going to approach the two of us differently because of our age difference?
Yes and no.
Okay.
I'm still going to ask the same questions. The thing that I may ask about, that I may do with somebody who's a little bit older, is that I may want to pay a little more attention to how they were feeling a week ago versus how they're feeling now, and if there's been a dramatic change, what their other comorbidities or other illnesses are, and how that's affected them, medications, that sort of thing. But for each person, the rules are still the same, and this has been one of the challenges in managing community-wide spread. The rules are the same for everybody. So if two people come in and they're 20 years apart, both symptomatic, and I've decided I need to test both of them, they both still need to isolate until they get those test results. They still need to, be masking and all of those certain things. But yes, I might spend a little more time with the person that's older to make sure that there aren't other comorbidities that are impacting how this disease will progress in them.
Okay, I have my mask, but I'm sitting here all by myself. You two are in the same room, therefore you have your mask on. I've been told it's that simple, that be aware of your presence, wear a mask, social distance, and wash your hands. Right? You're shaking your head, yes.
Yes.
It's that simple?
It's that simple because we don't have anything else right now. These are the biggest tools in our arsenal. We know that if people are masked and they stay about 6 feet apart, that if they wash their hands frequently, that this is the best way to protect themselves and others from this virus. And we know that because what we have discovered by observation is this virus is spread primarily by respiratory droplets. And those droplets are primarily airborne and not so much on surfaces, but they could be on surfaces. So that's why we ask people to wash their hands. So yes, washing your hands after you touch things, these are the best ways to manage this, to manage prevention. So yes, you're right, it's that simple.
Okay, we have a deal in my house that I'm the one that ventures out. I'm the hunter and gatherer. I'm putting my life in my hands. And so I'm wearing my mask. As soon as I walk in from the grocery store, I bring the groceries in, we stack them on the floor. My wife has cleaned the countertop. I've washed my hands, and there's very selective process that goes through in wiping down groceries, because that's what we heard about to do in April. But now I'm hearing we don't have to be that concerned. So that's where it gets confusing.
Yes, it does. You know, I feel like it's still, you can't go wrong by still cleaning off your groceries and whatever comes into the house. But what they have observed, what people, scientists who are watching this and testing it, they have observed that this virus doesn't seem to survive very long on surfaces, 24 hours or less. But you just don't know who happened to have touched that bit of groceries or whatever. So I guess the bottom line is if you just, for some reason, aren't able to clean it, you still may be okay. But I believe that it's still in your best interest to wipe things down.
6 feet, 10 feet, 15 feet. What's social distancing?
So the social distancing, according to CDC guidelines, is 6 feet apart. The virus it's pretty strong and it's pretty projectile, but we found that if you can maintain a distance of 6 feet apart, that it's less likely to spread.
Okay, I'm at the grocery store and there's somebody in front of the cake mix that I'm going for. I'll admit that's what I love at COVID. Or the ice cream. I guess I'll fess up to the ice cream that I've been eating. And I want to push him out of the way. Do I need to be worried about him?
So, that's a good question. If he's, close to you, he doesn't have a mask on, then yes, you might want to be a little more concerned about that person. But if that person is masked and you're masked, and say you're 3 feet apart, there is a higher chance that you could contract something from him if he has it. But the fact that you're both masked actually helps to prevent that transmission. So I would say, yes, you want to be careful. We still want to try as much as we can to stay 6 feet apart, but the masking is the next layer of protection. So that does help.
Because he is between me and my ice cream. So I guess being patient and a little might help.
Yes.
Okay, that leads to, should I be scared?
So great question. This is a really important question. And I tell patients, this is a very serious illness. But the worst thing that we can do is panic. So I tell folks, don't panic, but do take it seriously. Do be concerned because, it can potentially be an issue, but we do have some tools in our arsenal to protect ourselves. And we do have ways to manage this at home, which a lot of people will be able to do. But it is scary to folks, but I think when we panic, sometimes we may do things or set off systems in our body that will make us less able to fight infection as well, or make us choose different routes or make different decisions that may be harmful to us.
I get up in the morning and I clear my throat all the time. I got the post-nasal drip. I gag when I know too much information. I'm just healthy. That's my sign of waking up in the morning. Or should I be worried about that?
If that's what you have done for years on end, months on end, you shouldn't necessarily be worried about that. If it's a new thing and you had not had that previously, then that's something that you want to monitor. And that's the key, is you want to monitor symptoms. So, I tell folks, if you're not feeling all that great. Let's see how you're doing over the next 24 hours. Do you feel like that clearing of your throat has actually turned into a cough? Or the fact that you're getting a lot of postnasal drip and you find that you're bringing up sputum, has that made you more short of breath now when you weren't short of breath in the morning? So following the trend and monitoring yourself is really the answer.
Okay, this is the time that I blame my mom, because I had to go to school unless I had a fever. So if I got that cough or that kind of pain in the, my father was a Marine. I buck it up and I go on.
Right,
That's what I
right.
should be doing in today's environment.
I think in today's environment this year that we do have to be a little more mindful of symptoms that are different, even without fever. So, if you have a cough or if you have a runny nose, you've got a headache, muscle aches, you have stomach upset, or you're having loose stools, things like that weren't there yesterday. It's better to err on the side of caution and isolate yourself. Call your boss, call in and talk to your supervisor or manager. I think they will understand that until we're sure that those symptoms aren't going to progress, it's best for you to stay home.
Because we're dealing with a public health issue, not just a personal issue. And there are people out there that are saying, more people die in car crashes than COVID. Why are we so concerned? Why are we so concerned?
Well, we're concerned because over 200,000 people have died in the last 7 to 8 months. And we're so concerned because in certain vulnerable populations, the death rate is 2 times higher from COVID-19 than it is from anything else. So we don't want to see this escalate. And as you just mentioned, it's a community health thing and it will spread rapidly. So I think that we're concerned because we know that this has already shown that it's capable of shutting down our economy. And we don't want that to get worse. We don't want to overwhelm the health system, which we've seen happen in several states. We also are this concerned because now we're in flu season. And so now we have the threat of flu and coronavirus at the same time. So that's why we are making a big deal about this, because it could turn into a huge crisis on many fronts that will impact this entire country and world.
So when you go to a place like Prime Plus, and where we normally have 40 people in a classroom, be understanding that we only have 12 because of safety. That we're not violating your privacy by asking you some questions about your health, and we're going to take that temperature. Those are normal expectations in today's world then, right?
That's right.
You mentioned that 3-letter word. I mean, we've been dealing with the flu for centuries. I got my flu shot, by the way.
Yay, good job. Excellent.
Is it? So that whole question is, it hurts when I do that.
Right.
Anyway, so is it more important to get the flu shot this year?
I really think that it is. And I think that most healthcare providers will tell you that it is more important this year for a couple of reasons. The obvious one is that nobody wants to have flu and coronavirus at the same time. Nobody wants to have COVID-19 illness at the same time. We do not have a good treatment or prevention for COVID-19 illness, but we do have a tried and true measure of prevention for flu, which is the flu vaccine. And so as I ask my patients who sometimes are hesitant about it, the importance here is that you're doing a service for your community as well as yourself. Because many of us will present with symptoms or actually be infectious maybe 2 days before we actually present with symptoms, we're all a risk to the community. So this is a way to protect your loved ones, to protect others around you, to protect strangers you may come in contact with, your coworkers, by getting immunized with the flu vaccine. So this year, I think it is more important than ever because, flu causes so much death and illness during flu season that sometimes hospitals are overwhelmed between December and February. So this year, we're already nearly overwhelmed with COVID-19 cases. Can you imagine if we get overwhelmed again with flu and COVID-19? It's going to be unbearable.
Now, I got to quote Dr. Fauci because everybody does. Vitamin D, are herbal medicines, compounds helpful in any of this?
So this is a great question. We get this all the time. I think that what you will find is when you look at this and you talk to people like Dr. Fauci who've done a lot of looking at these types of treatments, there really has been no what we call robust research to support the use of supplements in prevention or treatment of COVID-19. But there have been small anecdotal studies that support the fact that using these things is biologically plausible. My battery's trying to run low. That it's biologically plausible to use some of these medicines, or herbal supplements. So vitamin D, for instance, has been associated when it's low with a higher incidence of respiratory infections. There's no clear recommendation that we can say, but maybe if we're taking vitamin D and our vitamin D levels aren't low, maybe there's less of a chance that we'll have, a respiratory infection like COVID-19.
Now, I got to tell you, doctor, I asked my wife that same question. I'm taking my supplements because she's giving them to me. 42 years married, I'm no fool.
I was going to say, you are a smart man. You have learned well.
Tell her that. So you have made it. You've been. And I'm assuming this is the kind of medical treatment, care, and attention that we get at JenCare. But I got to tell you, for the last half hour, you've been very calming to me. But you've also gotten across to me that I got to take it seriously, and that even though my mom and my Marine Corps father may have said, "Buck it up and get through it," you're not going to be a nuisance if you make a call and say, "I'm feeling this way."
Absolutely not. And in fact, most doctors are going to tell you they want you to call first, because then they can direct you so that they're able to protect their office staff, protect other patients, and also to protect you. So absolutely, I think calling, no physician, no healthcare provider is going to fault that.
Okay, one last question. I got two questions. One, sir, what is JenCare doing to ramp up for this thing to continue on?
So JenCare has been almost a pioneer in preparing for this pandemic. And one of the ways that we have been working is to try to make sure as many of our patients as possible do have video capability or have some access to telehealth, because there is a chance that we may have to shut down again if things get really bad. So we are looking at ways to make sure that every one of our patients has access to the physicians and to the staff. We have sent out kits with various just health things in it, like hand sanitizers and masks. We also send text messages every day to our patients. We make phone calls every day in some regard to patients. We do what we call love calls, where we just check on people to see how they're doing. And then we still, at the moment, we are seeing as many of our people as we feel safe and doing as much care as we can now while we can and while we have a little more latitude.
Fantastic. One last question. If I come in, will you tell me to cut out the ice cream?
Well, it just depends, Mr. Batcher. It's kind of mean to tell you to cut it out altogether, so we might just say eat half.
Okay, the beauty of Zoom is only from here up. So thanks a lot for really being conversational about a very serious topic. Really appreciate it. Thank you.
It's my pleasure. Our pleasure. Thank you for having us.
My pleasure. And as usual, stay safe and stay connected. See you later.